So I'm going to introduce Stephen Lopez. Stephen is Counselor to the Secretary of HHS on Equity for the Office of the Assistant Secretary for Health, Health Resources, and Service Administration and Indian Health Services. Stephen, we want you to put your camera on if it isn't already so that we can highlight you. There you are. Wonderful. We're thrilled to have you here, and we've had a really productive and exciting few days of panels and discussion, and we know that you'll send us off with some really important insight and words. So thank you for being with us.
Well, it's my pleasure. Well, thank you for the invitation to join you all today. Let me begin by thanking you all for joining for the past 2 days to investigate inequities in human services and ways to address them. I want to give a special thank you to those who have shared your expertise and stories born out of lived experiences during this event and provided your invaluable input and feedback on the state of human services in our country. We know we cannot do this work without you, and we recognize that we have a responsibility to value and honor your perspective by using it to influence how government responds. Equity is a top priority for the Biden-Harris administration and for Secretary Becerra. At the U.S. Department of Health and Human Services, we have been hard at work to identify and address inequities faced by many of the populations discussed today. We are collectively dedicated to making advancing equity a part of the fabric of how HHS works on behalf of all people. And we know that this work requires a deep and ongoing focus that is informed by evidence and steers toward action. I'm thankful at this event we've been able to hear from you all about how inequities in human services differ for people of color, LGBTQ persons, individuals with disabilities, and many others who have been adversely affected by inequalities over time, including those living in rural areas. I'm also appreciative that we've been able to hear from you about the intersectionality of these identities and the role human services should and should not play in addressing inequities faced by these different populations. And I'd encourage us to also think about approaches that include the experiences and needs of our immigrant communities moving forward. In particular, while there are many lessons learned from our discussions, I want to highlight a few key themes that we heard throughout these 2 days, one of which being that we can all do something to advance equity in human services. While we all play different roles, all of us have the power to do something to center equity. An area where many of us might be able to act is around data and research. Whether you're in the decision-making role of what type of data is collected, and I would say also disaggregated, or how research gets funded, designing and conducting research studies, or using research to inform your everyday work, considering how an equity lens can be incorporated can be crucial to the success of human services research at any stage. For example, as has been discussed, incorporating an equity lens in data and research may involve supporting community-based participatory research or collecting sufficient data to be able to investigate inequities in race, gender, and ability. We've also heard that receiving input from the community you are serving is a continual process that starts with including these communities and identifying problems, engaging them in interpreting the findings, and identifying the solutions that will work for these communities. Diving into how this can be done, not only at the direct service level, but also at the systems level is crucial to understanding how we can ensure positive changes are made along the full continuum of human services. Being at the Department of Health and Human Services, we are very familiar with how challenges between healthcare and human services can overlap. Yet, despite being under the same department at the federal level, far too often efforts in these two spaces are not coordinated. During the opening keynote of this event, we heard from Dr. Watkins-Hayes about the benefits of healthcare, human services, and others working to provide an HIV safety net. We know there are many areas where coordination and integration on these two fronts will be beneficial to address inequities faced by the American public, and are dedicated to working with our partners at the state and local levels to make these connections happen. Some of the suggestions for changes raised these past 2 days highlight opportunities we can work to implement immediately. such as acknowledging and using the gender or non-gendered preferences of transgender people and non-binary or non-conforming persons in our day-to-day conversations and in our work. Other items such as sharing data across benefit systems so people do not have barriers to applying for and receiving all the benefits they are eligible for may take some more time and resources to ensure that systems have this capacity. But we must begin to take the steps towards conceptualizing and planning how these types of advancements can be made if we are ever going to achieve them. And we heard you loud and clear that the human services field needs to do better to help address inequities created by other service sectors and to address the inequities that are created by the human services sector itself. We recognize that unfortunately, there are still many instances where human services has ignored or inadequately addressed equity issues. I can assure you that taking action and making concrete steps toward progress is of the utmost importance for this administration. We will take the information shared today on what the federal government can do to improve human services back to our teams to inform our equity efforts and hope that you all at the state and local levels will do the same. Because as we have heard during these past 2 days, the federal government cannot solve these problems alone. Speaking of our efforts at the federal level with respect to equity, I wanted to share with you all some of the work that is already underway at HHS, that the information from this event will help to inform moving forward. And fulfilling the requirements of the executive order on advancing racial equity and support for underserved communities through the federal government, we have been piloting equity assessments with offices to identify ways to address inequities in areas such as contracting and procurement, grants, and maternal health. Based on our findings from this work and the many other equity-related efforts underway at HHS, we are developing an equity action plan to take our learnings into action to address barriers to full and equal participation in HHS programs, procurement, and contracting. And as part of this plan, we will also be identifying metrics on our progress so that we can ensure we are working to meet our goals and correct our path if progress is not being made. Beyond our equity assessments and planning work required by the executive order, we are also incorporating an equity focus into the HHS strategic plan, which will be released next year. While not the focus of this event, inevitably the topic of the pandemic has come up in our discussions. I want to let you know that in addition to all of the efforts individual HHS agencies are undertaking to address COVID-19, we also have a COVID-19 Health Equity Task Force that is specifically focused on identifying and eliminating health and social disparities that have resulted in disproportionately higher negative COVID-19 outcomes for some communities. This task force was established by the executive order ensuring an equitable pandemic response and recovery and is being led by Dr. Marcela Nunez-Smith. Given this is such a cross-cutting issue, the task force also has representation from the U.S. Department of Agriculture, the U.S. Department of Education, the Department of Housing and Urban Development, the Department of Justice, and the Department of Labor. We anticipate that the task force will be narrowing in on recommendations to share across the federal government in the coming weeks, and we look forward to investigating how their recommendations can be used to encourage new areas to take action and are aligned with existing work. There's one silver lining from the pandemic. It showed us that these inequities, that we've created new solutions, new ways to do our work that center and prioritize historically underserved communities. Lastly, I also want to highlight our efforts on another issue that is just as important in our discussions on equity, and that is climate change. This is an issue where there has been a lack of action for far too long. And unfortunately, many of the populations that we discussed today as facing the largest inequities in human services are also facing the brunt of climate change impact. I'm proud to say that at HHS, we are tackling this issue head on and have established the first Office of Climate Change and Health Equity to fight climate change and protect these communities. This office will lead on several different efforts on climate change priorities, including identifying communities with disproportionate exposures to climate hazards and fostering innovation in climate change adaptation and resilience for disadvantaged communities and vulnerable populations. While human services may not be the first field to come to mind when thinking of COVID-19 or climate change, I raise these examples because we all know that human services plays a crucial role in assisting the populations that are most impacted by the inequities these issues have exacerbated, and that your work in human services can impact all aspects of people's lives. As we saw with Hurricane Ida, where community service block grant funding was made available to provide emergency assistance, such as access to support and nutrition services to help families meet basic needs. Human services are integral to our responses to various crises and disasters. Thank you again for the insightful ideas and dynamic discussions over these past 2 days. From our discussions on understanding and addressing inequities in systems and direct services to data and research, I hope this event has been illuminating and as useful to you as it has been to us at HHS. And we look forward to applying what we have learned over these past 2 days to our human services work. So thank you again for the invitation to participate, and thank you again for your thoughtful ideas and conversations over these past 2 days and for the work ahead.